Hi everyone, welcome to my YouTube channel. As you know, I'm very new to this. This is my second video. The first one I did it on the Hopkins med bag. I did a review on that. Today is going to be on home health. I've been doing it for 2.5 weeks only. I've been a nurse for a year. I worked at a clinic, did a lot of medical assistant stuff, so I didn't like it because I wasn't sharpening my skills as a nurse. So I did that 5 months. Then I started at a hospital. I did that 6 months and I couldn't handle it. The work environment, having 6, 7 patients, especially now with COVID, it was too much. I didn't have that one-on-one or patient interaction that I wanted. So I started doing home health and I enjoy it so far. I love the one-on-one interaction with the patients. So the pros of it is that you're more autonomous, which could be a pro and a con actually. Pro because, you start critically thinking even more. And the hospital helped a lot, like with PICC lines and midline dressing changes and whatnot. So that's a pro and a con, but the other pros is that you can schedule your patients whenever you like whatever days you're available and time. The other thing that I feel is very important, and it's another pro, is that I have, I don't know if other places, but I have the director of nursing who follows me, So we don't have any training, but if there's anything that I'm unsure of, I'm not comfortable with, or I've never done or don't recall, she'll just go out with me to be on the safe side and explain things to me. So that's a plus, especially as a novice nurse who's just starting home health. This is very new to me, very different, So if there's any nurses out there that can give me tips or advice on the plan of care, or the visits, that's where I'm still a little confused, but I'm getting there slowly but surely. But I appreciate the people at the company that I work for. They're awesome, helpful, always there to answer questions and whatnot. So that's awesome. The con is that you don't get well paid in the beginning because you're barely starting. So you have to build up like a patient list of patients who you're going to be seeing as the start of care when they're new to you, or the follow-up visits. So that's the only, I feel like that's the only con part. Everything else I feel like it's a pro. And I know some agencies, they'll pay you per visit, which is the agency that I'm in, or they'll pay you an hourly rate. So that's another con in a way, depending if they pay you a lot or not. But it all, in the agency that I work for, it all depends on how many patients you see. That's how much you're gonna make. So it's per visit, not hourly. But so far I'm enjoying it. I'm loving it. It's more of what I wanted. And I know everybody has what they like, and I knew I wasn't meant for the hospital. I knew that off the bat as soon as I started. But I decided to give it a try because I don't like to stay with the what ifs. So I'm improving little by little, there's a lot of paperwork to fill out, but it's very repetitive. So it feels like you're doing the same thing over and over and over again. So you just kind of, copy what you've done prior. I still haven't started online because I know some agencies provide you with iPads, some don't, and it depends if you're per diem, which I am, or if you're full-time or part-time. So that's another thing. But I can't wait to start doing stuff on the iPad, with the software, because I'm usually very good at that. So I hope this gave a little bit of insight to any new nurses or nurses that have started recently with home health. If there's anything else that you have questions on, or you would like me to include in another video, or any comments you have, just post them down below. And also, if you guys have any feedback or advice on how to improve being a home health that would be awesome. As I said, I've only been doing it for 2.5 weeks. So I'm very, very new to this. So I would appreciate any advice or comments that you have. Thank you. I hope to continue making more videos. As I said, I'm very new to making videos as well. So thank you for watching. Bye.